Chapter 4: Between Scalpels and Sunlight. When universities reopened after the Cultural Revolution, they assembled the best of everything. The most brilliant professors and doctors were brought in to teach us. After a decade of academic drought, everyone was eager to learn. My university was one of the top institutions, with partnerships across the city's leading teaching hospitals. The wealth of opportunities to learn and practice medicine was incredible. Our training in Western medicine was as rigorous as anything taught in Britain, held to the highest standards. But unlike Britain, our curriculum included something unusual: Chinese medicine. Not just herbs and acupuncture on the side, but properly and systematically taught alongside Western medicine. Even our physical education classes were different. Instead of just running laps or lifting weights, we practiced Chinese martial arts, including Tai Chi Quan, an ancient exercise designed to balance the body, calm the mind, and strengthen the spirit. At first, I thought it was too gentle, something mainly for the elderly. But as I continued practicing, I discovered how invigorating and beneficial it really was. One day, while cycling home, I suddenly felt a powerful surge of strength in my legs. I pushed harder, and the bicycle seemed to fly forward effortlessly. I was amazed. The only change in my routine had been the Tai Chi class we'd started 2 months earlier. Soon, my classmates and I grew to love it. During study breaks, instead of just sitting and resting, we'd gather to practice Tai Chi together. It became a refreshing way to recharge and reconnect, turning our breaks into moments of calm and renewal. Modern research has now confirmed what we discovered as students. Tai Chi improves strength, balance, focus, and emotional well-being. It helps the body and mind work together in harmony. As one classic saying puts it, "一动不如一静, 静中有动有静." Stillness is greater than movement. Within stillness, there is movement, and within movement, stillness remains. For me, Tai Chi is not just exercise. It is the #1 practice for longevity, a lifelong gift I continue to treasure. It was a strange and beautiful mix. Western science in the lecture halls, Eastern wisdom in the courtyards under the sky. One of my most unforgettable mentors was Professor Zhang Shaoqian from Peking Union Medical College Hospital, Beijing Yuan. He was over 80 years old and still made his rounds in the medical ward. I felt deeply honored to learn from him. I remember a patient of mine, a 33-year-old woman with severe tuberculosis. We tried everything, 4 different groups of antibiotics, but nothing worked. Her fever stubbornly stayed at 40, sometimes 41 degrees Celsius. Our consultant finally asked Professor Zhang for his advice. This gentleman, moving slowly but radiating quiet authority, took a small notepad from his pocket. He carefully wrote down everything I said, even though my notes were far from perfect. I was just a young student, and I felt embarrassed, thinking I'd wasted his time. Then Professor Zhang shared a story. 20 years ago, he said, we didn't have the treatments we do now. All we had was sunshine, good nutrition, and rest. And with just that, we saved many lives. He looked at me and said, let's continue the antibiotics, but we'll add supportive care. Let her truly rest. He explained that good rest didn't mean simply lying in bed. It meant complete physical and psychological rest. The patient should stay in bed at all times with every need attended to: food, water, even a bedpan, so she wouldn't need to move at all. Let the body and mind recover fully. It sounded almost too simple to be true, but 3 days later, her fever finally broke. It was a lesson I would never forget. Never give up. Even when exhausted and out of options, there is always something more you can do. And sometimes, the simplest, most fundamental principles, the ones we overlook, are what truly make the difference. It's not always about expensive drugs or advanced equipment. Experience and simple wisdom count. That's what you go to the hospital for. That's the real magic. The wisdom I gained from Professor Zhang, the value of fundamental principles, stayed with me. Little did I know, this insight would come full circle in my academic journey years later. While Professor Zhang's teachings left a deep impression, my time in the surgical department was equally transformative. The surgical training at Peking Union Medical College Hospital was nothing short of inspiring. Watching how quickly patients recovered from procedures and seeing the seamless integration of Western surgical techniques with traditional Chinese osteopathy cemented my decision to become a surgeon. In the orthopedic department, the combination of precise anatomical knowledge and the ability to use X-rays and anesthesia allowed surgeons to perform what seemed like miracles. I vividly remember a visiting patient from the U.S. who had a complex fracture. In America, surgery would have been the only option: metal plates, screws, the full works. But our team, led by the remarkable Dr. Ren Yu, performed a realignment using a combination of traditional techniques and modern medical tools. The patient was under epidural anesthesia, comfortable and even chatting with us, while the team carefully realigned the bone in what felt like no time. The patient's recovery was fast, and the joy on her family's faces was unforgettable. This case perfectly highlighted the strength of combining Eastern and Western medicine. In the West, such a fracture would have been treated with invasive surgery. Dr. Ren and her team chose a conservative approach, manual realignment with great precision, confirmed by X-ray, followed by casting and natural healing. She later told us that she had sent her X-ray to the U.S., where the surgeon said she would need full surgical fixation. She was amazed by how effective and gentle our treatment had been. Seeing these results firsthand reinforced my belief in the power of integrated medicine. It showed me the incredible potential of holistic patient care, where ancient knowledge and modern science work hand in hand. It was this beautiful blend of tradition and innovation that ultimately inspired me to become a surgeon and to carry these principles into my own practice. End of chapter 4.